Approximately 1 in every 5 Ontario youth younger than 18 experience a significant emotional, behavioral, or mental disorder which interferes with their everyday normal activities. Children and adolescents experience serious anxiety disorders, mood disorder, including major depression and bipolar disorder, schizophrenia, first episode psychosis, attention deficit hyperactivity disorder, and behavior disorders, including oppositional defiant disorder and conduct disorder. We know that mental health disorders in children and adolescents challenge many Ontario families. Unfortunately, we also know that mental health services reach only 1 of every 6 children and youth in Canada who requires help. We need to get better at identifying when our kids need help from family doctors, social work, psychology, and psychiatry, and we need to work together to fight the stigma attached to acknowledging a mental health problem. What is mental illness? A commonly accepted definition includes reference to behavioral and emotional responses that reflect distress, suffering, and impairment in ability to function adequately at home, school, and in the community. Mental illness is caused by social stresses, genetic inheritance, and individual predisposing factors, including learning disability. In addition, we know that many mental illnesses begin to emerge in adolescence. Parents and other family members are key in helping to alert the individual to the possibility that their uncomfortable feelings reflect the beginning of an illness that requires treatment. The first challenge for parents is to try to decide whether the issues they are detecting in their children and adolescents reflect normal struggles of childhood and adolescence or are indicators of developing mental illness. Parents hear their children talk about feeling like they have no friends, that the other kids at school are smarter or more athletic than they are. Our children tell us that they're sometimes feeling bullied or lonely, like they cannot fit in. How can parents determine when to respond to those statements by pursuing assessment and treatment versus offering family support, consultation with teachers, and provision of advice to the child? Paying attention to and accurately identifying the symptoms is key. Early identification is the first step towards effective treatment for children and youth with mental health problems. The symptoms of various common childhood physical illnesses are much easier to identify. We place a hand upon our child's brow and can tell if a fever is present. We know where to go to seek information about the signs and symptoms of common physical ailments, and we are also very clear about how to obtain medical help. Mental illness in our children is a very different situation. It can be hard to distinguish between a normal response to the challenges of school and friends and behavior that likely warns of the onset of a major mental illness. Some of the warning signs of possible mental health problems include social withdrawal, increased irritability and outbursts of rage, a reduction in appetite, changes in sleep habits, ceasing to be involved in pleasurable activities, not seeing their friends as much, complaining of being terribly worried or anxious, changes in energy level, incidents of self-harm, not keeping up personal hygiene, being fixated on weight loss, excessively using drugs or alcohol, talking about wishing they were dead or wanting to end things. Of course, all of these signs seen in isolation or observed infrequently can reflect a response to a temporary stress. Parents should attend to 4 factors in their efforts to determine if they should seek mental health treatment for their child. They should ask themselves, is the problem intense? Do these disturbing behaviors continue to be present over a significant length of time? Are their child's behaviors and reported emotions pretty normal for a child of that age? Do those behaviors interfere with the child's ability to take part in normal activities of day-to-day living? Of course, certain symptoms present as so severely debilitating that parents have no difficulty identifying their child as requiring urgent attention. Children and youth may present with symptoms of major mental illness, including early onset psychosis and schizophrenia. They may exhibit extreme suspiciousness of others that they would normally trust, unclear thinking and reasoning that makes no sense to others. They may describe hearing voices or seeing things that others do not hear or see. They may carry on conversations aloud with those voices. The emotions of the child may not match their circumstances, so they may be smiling or laughing inappropriately. Our children and youth may also frighten us with self-harming behaviors such as cutting or burning. Those behaviors may not be directly intended to lead to death, but are certainly indicators of significant mental health problems and should be taken seriously, as they also indicate heightened risk of later suicide attempt. It is important to remember that suicide is the third most frequent cause of death in young people under the age of 18. Who are the professionals that we can turn to for help? Your family doctor can refer you to a child and adolescent psychiatrist. The psychiatrist will complete a thorough assessment by meeting with you and with your child. He or she will want access to all previously completed assessments and school records. The psychiatrist will focus on such factors as medical factors that may contribute to your child's problems, history of mental illness in yourself, your partner, or your families, school and social functioning of your child or youth, symptoms of mental illness, past treatment activities, and their success. The psychiatrist will arrive at a diagnosis and will make recommendations for treatment, which could include medication and individual and family therapy, as well as further assessment. For example, a psychoeducational assessment. The social worker or psychologist can offer individual therapy focused on coaching healthy coping skills, family therapy to coach parents in the coping skills their son or daughter has been taught, as well as to address parent-child communication, group therapy aimed at developing positive coping skills, educational assessment, and recommendations to the school to assist and support the young person in the classroom. How to access those services in our area? If you think your child or youth needs help, you can receive services through a Children's Mental Health Centre funded by the Government of Ontario and free of charge to you. You can also choose to retain the services of a private therapist and pay for those sessions yourself or through your work benefit plan. Your family doctor can refer you to a child and adolescent psychiatrist. A referral from a physician is required in order to see a psychiatrist because they are a medical specialist and are funded through the Ministry of Health.